Okay, this is another Renew Education case study. This is actually the lower. We talked about the upper already on this case, so look for the upper. This is a great case if you're interested in doing some sort of full arch case or your first full arch case. There's not a whole lot that gives me a warning except if you have medical problems, if this patient's a smoker, diabetic, a lupus patient, what have you, that this is where this case would go downhill and healing around the implants would be very difficult. But otherwise, in terms of our treatment assessment, things look pretty good. We have pretty much a green, solid green on the IA nerve for sure. This is a perfect example of like an excellent IA nerve situation, and the bone density looks good, the facial bone looks good, the ridge height looks good, detached gingiva looks good. So the only thing was there's a little bit of a constriction on some of the teeth in the lower area here. There is perio, there's some disease back here in the second molars, but overall things are pretty well contained. We talked about the upper being a full arch case already. So now looking at the lower, what could you do? A case like this is so great. You could do anything you want to do, meaning 4 and more. So you would do 4 locator, you could do a 4 hybrid case. I wouldn't recommend that so much because if you have such a good solid situation for not that much more cost, so unfortunately dentists charge by each little line item. If they try to group that and give a discount accordingly, it's so much faster to do maybe 6 implants here on the lower and come out with a really great outcome. So if, let's just say you do what I call 8 or more, or on the lower it could just also be 6 or more, and you do, in this case, if you did 6 implants, you could do 3 unit bridges on there. And that would be something right here. You can go canine to canine. So you do an implant here, and you do the implant here. And you would be looking at doing something across here. And now the next implant would go here. And you would do an implant here. And then you do something in the first molar position. So on a lower, this is what you would like to do because this all works. If you had native teeth next door somewhere else, you know, this is a full arch from molar to molar, and you have separated out, technically you're hybrid, but you're just doing crown and bridge, and you're just doing unit pieces that allows you to offer like something better and fixed on 6. So you could do the 6 locator attachment case here. Probably wouldn't recommend it. It's probably just as cheap or less to do a fixed situation. The only hesitation when you do something fixed is that this patient already has a history of all that calculus that's built up here and all the decay. Clearly this patient doesn't have the habits that they need to actually maintain the restorations that you have. So that's the time that you have to kind of work with the patient and either explain to them that dentistry is not better than what you originally had. It's not impervious to disease. It's going to get calculus. You still have to improve and get your cleanings and all that stuff on the implant versions of things. So this one, you know, would be less hassle for you long term, and it would be more hygienic for a patient if you went down the locator attachment overdenture type way of going. So let's look at the CT. Let's look at the bone a little bit here. Okay, so now if we were to go into those areas here, let's say that canine area here, we have that facial bone. It's pretty strong out here. The tooth is this. You could do an immediate placement, the ones I always pick on, or let's say do a 3.5 by 7 by 11. That is plenty of implant there. That's an 11. So you can imagine you've got 13s you could put in here. I'd probably now make that a little bigger because now that I see how much space it really is, maybe we do a 4.2 by 13. So that's a really good size implant, and you're going to kind of bring that down further in. So you would have for sure an immediate placement scenario here, and we're still very far away from the nerve area. So this case is a great starter case. We can go through the rest of it. I don't think it's necessary. Here's where the bone is a little bit harder than I like, but it's still good. Facial plate, that's why I could say yellow on the constriction, because it kind of constricts a little bit higher up. Let's look at the bone going into the first molar area. Here there's a little bit of disease. You can take that out, let that clear up. But this looks really good. Look how low that nerve is down there. Look how nice that bone is. It's nice and solid. That's fine. It's going to heal really well. And then on the other side, if we go to the canine area here, let's see, this is now going into 27. So same thing, don't be surprised about that. And if we go over to the first premolar, you know, the bone looks really solid, looks really good. And now if you go into the molar, this is now the first molar area here. You know, those root tips aren't really doing much. You have a little bit of a drop in the ridge, but overall you can pop these little root tips out, and the nerve is way down there. And just for looking at, for sizing sake, let's do a 4.2 by, I don't know, let's do a 13 just to get a long one in there again. See where we're at. You can go straight down here. This is also a really good case if you want to do a surgical guide. And you could do it in a couple ways. If you really want to be dependent on it, of course, a tooth-borne surgical guide is probably one of your better ways to go. I don't know if I would waste my time trying to do half and half, but I would say just take out the teeth, let the ridge heal, do an impression, then make your plan on an edentulous ridge, and then do a surgical guide. And it's going to have to be a tooth or a tissue-borne surgical guide for a full arch case. But this is a great starter case for anybody that's looking at doing the full arch of implants. And this is also a great way to discuss patients, the differences between a hybrid case and an overdenture case, a locator overdenture case, whether it's a bar overdenture or regular overdenture type stuff, zirconia versus PFM versus, you know, a fixed, like a hybrid, acrylic hybrid. This is that case that you can have a lot of conversations around for 6 implants or 4 implants. And I would say if this is some of your beginning stuff that you're starting to do, I would recommend probably going into 6 implants or 8 implants, and I would be doing fixed bridge, crown, and bridge work. So that's another thing I didn't bring up. If you did 8 implants, you would be going, basically the canine would be the solo one, and you would be doing a bridge from here to the 4 anteriors, and then you would also then be doing a bridge from the first premolar into the first molar area. So you do a 3-unit bridge, single unit, 4-unit bridge on the lower anteriors, single unit, 3-unit bridge going into the back. That's a great case. If it were me and this was me, that's what I would do for myself. So I always talk to patients about what I would do for myself. I don't tell them what they have to do. I tell them what they can do and educate them as much as possible. The best question I think that the patients do ask, if they want to know what would be best, they always ask, what should I do, doc? What's the best? Well, nothing's really the best. They're just all different. There's pros and cons amongst everything. But because I do keep my teeth clean, because it doesn't cost me much to do these implants, and I have a friend do it, I would do 8 implants, 2 3-unit bridges, 1 4-unit bridge, and 2 single canine unit implants for those teeth. And the nice thing is that you've got immediate placement, so you know exactly where those canines actually were. So a guide probably won't help that much if you do immediate placements in this case. If you do an immediate placement in this case, you've got to clean this up at least a week or so in advance. Actually, I would say the protocol should be do a scaling replaning, clean all this stuff up, give them a rinse, get them on oral antibiotics, and about 3 to 5 days after they're on oral antibiotics, that's when you take the root tips out, or you can even take some of these root tips out now while you clean all this stuff up, so you get some of the disease out right away. Clean it up just so you get all the bacteria out. Then you go back with all the regimen of the oral rinses and the antibiotics. Then you have a clean slate. When you take these teeth out, you have much lower chance of infection and losing those implants due to any kind of bacteria that might be there. So anyway, that's about it for this one. This is a nice one. So hopefully you'll find one of these soon so you can get going on your full arch restorations and rehabilitation. But that's about it. So like us on Facebook and subscribe to us on YouTube, and we'll see you soon.